Okay, so we're going to start. Here is the first slide. Just a second, because we're preparing it. Okay, I think you can see it properly here. Is there a relationship between migraines and digestive disorders? Well, obviously there is. And here we're citing Swanson, who we quote him because he thinks there is a relationship between headaches and the intestine. Nausea and vomiting are usually associated to migraine attacks, something that we've seen very repeatedly. And also research suggests that people with frequent headaches have more probabilities of developing gastrointestinal disorders. And in children, there are several syndromes that cause gastrointestinal symptoms that are associated to migraines as well. These syndromes can cause vomiting episodes, so cyclic vomiting, abdominal pain, which is also called abdominal migraine, dizziness, vertigo, and usually we call them periodic syndromes of infancy or occasional syndromes associated to migraine. Although they're not accompanied by a headache, they're considered to be a form of migraine. The requirement of headache is not considered for it to be considered a migraine. In any case, these periodical syndrome become migraines in their adult life. Well, I think that this morning we've been talking about histamine and something which is in meat-processed product, bluefish, eggs, cheese, and some milk derivatives, also soy derivatives and kiwi, citric fruits, vegetables like spinach, tomato, aubergine. But I think that we will talk about all of that with Dr. Duero. Let's very quickly remember the ways of catalyzation of histamine. One of them is not very active, is that with histamine and methyltransferase, which becomes N-methylhistamine, and it becomes N-methylimidazole acetaldehyde, and it ends up being eliminated by urine. There is another way which is more powerful, and it's the action of diamine oxidase, or DAO, and it becomes this acid by oxidation, and it becomes imidazolacetic acid, and it's eliminated again by through the urine. And a third way would be intestinal bacteria, the acetylation of histamine ingested in food, and if there is a lot of histamine because the food is not very well preserved, then we know about the histaminosis, which is a more complicated health problem. The non-adequate functioning of diamine oxidase, which could be because of a genetic cause or acquired origin deficiency cause, it's one of the main reasons for this DAO deficiency, which affects more when it's acquired. When it comes to DAO, it's a acute gastroenteritis or intestinal disorder, the chemical blockage of enzymes, among them DAO, by the use of drugs, or a chemical blockage of enzymes by alcohol. And this leads to a deficiency of diamine oxidase. The genetic origin is known and it's been studied, and I think they've talked about this as well this morning. This DAO deficiency produces migraines, abdominal pain, and some symptoms that we'll agree imitate somehow allergic reactions. For example, vomiting, diarrhea, nausea, fatigue, muscle pains. And these ways of these symptoms, we have to take into account these DAO deficiency, because quite generally we don't think too much about it. We think about fibromyalgia, reflux, but we have to take into account that that's one of the ways of manifestation of this DAO deficiency. There is something that I think that this morning we mentioned, subtle cases with just slowly diminished DAO values, and this is something that leads to misdiagnosis. When the subject eats more food with histamine, then they can have a reaction, which is migraine or abdominal pain. But when it goes over its enzymatic capacity, but we say, it's like, yesterday I ate tomato and meat derived products, but today, I ate more of these and I don't feel okay. Well, that's the idea. It's the quantity of histamine that we've been receiving. It means that just a little bit more can mean that they're going to develop these symptoms. Also, alcohol, which has a lot of histamine, although in Spain we have more and more wines with low histamine. But we have wine with a lot of histamine as well, and alcohol can reduce the activity of the DAO. So that means we have all experienced sometimes this hangover after having drunk a little bit too much. Also, the beginning of some digestive diseases with alteration of mucose, like the celiac disease, gluten intolerance, etc. That could be symptomatology due to DAO deficiency. Diagnosis could be a suggestive clinical pattern of DAO deficiency, low levels of histamine, and also discarding all other pathologies. I would like to quote a very interesting work by Dr. Rosell from Palma de Mallorca, published in this magazine of digestive disorders. And they carried out a study, a retrospective one in 3 months in children, diagnosed of histamine intolerance according to Mainz and colleagues' criteria. 2 are digestive symptoms, vomiting, diarrhea, also low DAO in plasm. They respond to a low histamine diet among them, and in these authors they found diamine oxidase, which was inferior to 3 units per liter. So it's an important deficiency. The average age was 4 years old, evolution of 2 years and a month, and they all improved with the administration of DAO food and a low histamine diet. In some more severe cases, we can help the patient with H1 dexchlorphenidramine or H2 ranitidine, or the administration of supplements which act as cofactors of DAO, for example, zinc, copper, vitamin C, or vitamin B6. The syndrome of cyclic vomiting. This is a very difficult to suffer, because we have a lot of vomiting for several days, and in any case, we would have to determine a problem with DAO. This is all very well known in the world. We have author Sanchez Salvador in Colombia, or also Micaela, who has been talking about the evidence of DAO. So fortunately, the dissemination of the knowledge on DAO is a reality. The differential diagnosis is important. We need to think about allergy to foods, and quite recently anisakis. Sometimes fish and seafood can have a lot of histamine, but they can have parasites like digital oxaca or anisakis, which can produce symptoms that simulate this DAO deficiency. Also celiac disease, atopic dermatitis, and intolerance to carbohydrates. Usually the tests are not done properly. Also the irritable bowel syndrome, and other important cases when we study this DAO, like biliary lithiasis, pancreas-related problems, over-related pathologies, intestinal malrotation, mesenteric impeachment, diets excessively rich in vegetables, etc. We have to discard all of these possible reasons before we're sure that there is a DAO deficiency. In our experience, we carried out an observational study in 2 years in our unit in Villa Augusta, 110 women that were visited because of abdominal with bloating, and 369 had pathologies like the ones that I cited. And in 41 cases, there were no pathologies like this, and they had DAO figures under 3 kilounits per liter. So that meant an average of 10% of DAO deficiency in patients with abdominal pain. All of these patients improved with the administration of DAO food and with a low histamine diet. As a conclusion, and because I want to stick to my time available, I wanted to highlight the ubiquity of deficiency of DAO. As I know that this has been commented on already, it can present itself in many ways: migraine, digestive disorders, etc. So we need to think about all of that, and we feel confused by the fact that if you have just a little bit of those food, that's okay, but if you have just a little bit more, and if we go a little bit over the capacity, the enzyme capacity of metabolization, then we would have all of these symptoms. And this is very confusing for patients and the doctors that treat them. So let's remember that 10% of women with abdominal problems, and in adults and children as well, because the work of Dr. Rosé talked about 10%, they could have a deficiency in DAO, which can improve with the diet and treatment with DAO food. Children are not away; they can suffer from this problem as well. And this cyclic vomiting, we do not think a lot on this, on the DAO deficiency, and this can produce a future crisis. And I repeat, the ubiquity of deficiency in DAO. So the multiple symptomatology. So do not get confused by the fact that one type of food doesn't produce any symptom, but if they eat a little bit more of that same food, all of those reactions can be triggered. And let's remember that this is a little bit of a joke, is the most used preconception method in married women in this country. And thank you very much. And I will invite you to repeat Professor Duero in Barcelona. And maybe if we can, maybe we can all be there face to face, because it's an open city, open to everybody. And again, thank you so much for your attention.